My question is for Dr. Tedros, and you spoke about that a bit, but I want to ask you for a further comment. We lost recently in Bosnia and Herzegovina one of the leading experts on this field who passed away, and he worked with the WHO, and that's a very hard situation. Dr. Pashagic have passed away, and we have a conflicting informations here why he had passed. He was infected home, and that's a very hard situation. And we hear from other medical doctors and nurses and workers around the world. So what we can do to prevent situations like this in the future, and also what we can do to increase money for research, which is necessary at the moment, and we know that many countries are talking about that. Thank you so much.
I think it's always been true, and it's more true than ever in this response, that frontline health workers have always been, unfortunately, the mine canaries in epidemic response, particularly in systems that don't have strong surveillance systems. The number of times in my career where the death of a health worker was actually the event that triggers the epidemic response. Too many times in my career, that has been the tragic stimulus to action. We owe a huge debt to our frontline health workers, and they ask for nothing more than the training and the protective gear to do their jobs. And we need to ensure that they get that. We also need to ensure for the future that surveillance systems are in place, that we're able to prevent infection spreading in hospitals. Again, as we're dealing with the ongoing situation in Congo, at one point during the outbreak of Ebola in Beni, at one of the most intense periods in the outbreak, nearly 70% of the cases were actually being transmitted within the healthcare system. So it shouldn't be a surprise to us with MERS, with SARS, with Ebola, that the healthcare environment is an environment in which people can be saved and treated, but it is also an environment in which viruses and other things are present, and we need to protect patients and we need to protect those health workers. It takes a long time to build a health workforce, and it should not be sacrificed to any virus, and it should be protected. And especially true in countries that have invested precious development funds in building a health workforce, which is central and vital to the health system. A health system is not bricks and mortar. A health system is not technology and infrastructure. That's part of it. The heart of a health system are the health workers, and everybody knows that. And we do have a short-term objective now, and that is to get the best possible protection to those workers, and all of us have a responsibility in that. But also for the long term, we have to learn the lesson. We can no longer leave healthcare systems exposed to infectious diseases without the protection and the capacity to manage those. And that's going to be a big discussion that needs to happen, and I believe should happen before this epidemic ends. But the Director General may have a comment to make on this, because he's involved in much discussion with this, with our G20 partners and others, and how we strengthen the system and never let this happen again.
Yes, so just to add to, in addition to the personal protective gear that we must provide to our frontline workers in masks, medical masks and respirators, gloves, gowns, and we must train our healthcare workers. So what we've seen from the recent studies that have been published on healthcare worker infections, which we're very grateful to see evidence around this. I first should say sorry for the loss that you mentioned. What we must do is we must train our healthcare workers for respiratory diseases, for infectious diseases, because what we've seen is in some initial cases of healthcare worker infections, they've been infected in different wards where they're not used to infectious diseases. They may be long-term care wards for older individuals, and so they just don't have the training. And right now, with COVID-19 circling the globe, all healthcare workers must know about this virus. They must know how this is transmitted, and they must know how to protect themselves. We have trainings that we've put up on our open WHO platform, which are interactive, which can teach healthcare workers about what this virus is, how it is transmitted, and how they can protect themselves. And not only what needs to be worn, but how to put the materials on, how to put the PPE on, how to take the PPE off safely. We must also find ways in which we can provide psychosocial support to our healthcare workers and our frontline workers, because this is a very difficult position that all of them are put in now or will be put in countries that have not yet seen large numbers of cases. We need to find ways in which we can provide some rest periods for them, so that they don't have very long extended shifts or too long of extended shifts, and they have ample time to rest. Because when fatigue sets in, it's possible that maybe the personal protective equipment isn't taken off properly. And that's not to blame the healthcare worker. So there are things that we can put in place, and right now we have tools available to train every healthcare worker on the planet. And that is something that we look forward to working with all of our member states through our regional offices to do this training so that they can be better prepared to protect themselves against infection and provide the best care that they can for all patients with COVID-19.
Just one thing I would like to say. Countries who, relatively have the strongest health system have been actually surprised by this pandemic. It shows that any system could have gaps. And we should have the humility to see to what extent our system is prepared and where are the gaps and how can we improve it for the future. I think from this pandemic, we have to try to learn, focus on learning what the gaps are. This is not a message only for the developing world. This is a message even for the developed countries. Across the board, you see lack of preparedness of the public health system, and of course, the whole health system. And that's why WHO has been advocating for universal health coverage, health for all, strong health systems, and with a strong foundation of primary health care. And within that, strong preparedness, especially in public health, to prevent outbreaks. That's the best, actually, the best option. And if it happens, to diagnose early and respond quickly and arrest it as quickly as possible. But we can see now, through this pandemic, there is a serious challenge or vulnerability even in countries who claim to have the strongest health system. I think this should bring humility to all our countries and see and assess the situation carefully, understand the gaps carefully, and understand the importance of health for all. We should not go into the cycle of panic and neglect. As you all know, we are now in a phase of panic because there is this dangerous, invisible virus which is wreaking havoc, and there is panic, and there is concern, but that should actually lead into asking questions on what to do to strengthen our system and to improve or reduce the vulnerabilities that we have. So the risk which is coming to our health professionals is because of weak health system. The reason why we're not detecting or preventing the outbreak easily or quickly is because of weak health system, because of serious vulnerability. And I don't think there is, from what we have seen now, no country is immune. No country can claim that it has a strong public health system or a strong health system. So we have to really be honest and assess and address this problem to provide better services to our people, but at the same time to protect our health professionals too.
Thank you very much. Next question comes from Brazil, Ana Pinto. Ms. Pinto, can you hear us?
Oh, yes. Oh.
Yes, please go ahead.
I can hear. Can you hear? Okay. Fine.